Do you have psychological stress? What is psychological stress? It is 3 a.m. and you awake with a start. Did I feed the dog? Did I miss the alarm? Did I forget to lock the doors? Awakening in a panic with psychological stress is an all too common occurrence for most humans. In fact, 3 to 4:00 in the morning is called the anxiety time because it is actually a time when the body is resetting any critical systems that can cause disruptions in your sleep. But the fact is that your cat will never have a restless, sleepless night worrying about the bills. This is a uniquely human feature that is at the root of much of our stress. Negative thinking habits are at the root of much of this stress. It is something that we need to learn to manage, as you will discover in the article below, what it is, what it is not, and some of the negative consequences of doing nothing about it. Psychological stress. What is psychological stress? Psychological stress describes what people feel when they are under mental, physical, or emotional pressure. Although it is normal to experience some psychological stress from time to time, people who experience high levels of psychological stress or who experience it repeatedly over a long period of time may develop health problems, mental and/or physical. Stress can be caused both by daily responsibilities and routine events, as well as by more unusual events, such as a trauma or illness in oneself or a close family member. When people feel that they are unable to manage or control changes caused by cancer or normal life activities, they are in distress. Distress has become increasingly recognized as a factor that can reduce the quality of life of cancer patients. There is even some evidence that extreme distress is associated with poorer clinical outcomes. Clinical guidelines are available to help doctors and nurses assess levels of distress and help patients manage it. This fact sheet provides a general introduction to the stress that people may experience as they cope with cancer. More detailed information about specific psychological conditions related to stress can be found in the related resources and selected references at the end of this fact sheet. How does the body respond during stress? The body responds to physical, mental, or emotional pressure by releasing stress hormones, such as epinephrine and norepinephrine, that increase blood pressure, speed heart rate, and raise blood sugar levels. These changes help a person act with greater strength and speed to escape a perceived threat. Research has shown that people who experience intense and long-term, that is, chronic, stress can have digestive problems, fertility problems, urinary problems, and a weakened immune system. People who experience chronic stress are also more prone to viral infections such as the flu or common cold and to have headaches, sleep trouble, depression, and anxiety. Can psychological stress cause cancer? Although stress can cause a number of physical health problems, the evidence that it can cause cancer is weak. Some studies have indicated a link between various psychological factors and an increased risk of developing cancer, but others have not. Apparent links between psychological stress and cancer could arise in several ways. For example, people under stress may develop certain behaviors, such as smoking, overeating, or drinking alcohol, which increase a person's risk for cancer, or someone who has a relative with cancer may have a higher risk for cancer because of a shared inherited risk factor, not because of the stress induced by the family member's diagnosis. How does psychological stress affect people who have cancer? People who have cancer may find the physical, emotional, and social effects of the disease to be stressful. Those who attempt to manage their stress with risky behaviors such as smoking or drinking alcohol or who become more sedentary may have a poorer quality of life after cancer treatment. In contrast, people who are able to use effective coping strategies to deal with stress, such as relaxation and stress management techniques, have been shown to have lower levels of depression, anxiety, and symptoms related to the cancer and its treatment. However, there is no evidence that successful management of psychological stress improves cancer survival. Evidence from experimental studies does suggest that psychological stress can affect a tumor's ability to grow and spread. For example, some studies have shown that when mice bearing human tumors were kept confined or isolated from other mice, conditions that increase stress, their tumors were more likely to grow and spread, metastasize. In one set of experiments, Tumors transplanted into the mammary fat pads of mice had much higher rates of spread to the lungs and lymph nodes if the mice were chronically stressed than if the mice were not stressed. Studies in mice and in human cancer cells grown in the laboratory have found that the stress hormone norepinephrine, part of the body's fight-or-flight response system, may promote angiogenesis and metastasis. In another study, women with triple-negative breast cancer who had been treated with neoadjuvant chemotherapy were asked about their use of beta blockers, which are medications that interfere with certain stress hormones, before and during chemotherapy. Women who reported using beta blockers had a better chance of surviving their cancer treatment without a relapse than women who did not report beta blocker use. There was no difference between the groups, however, in terms of overall survival. Although there is still no strong evidence that stress directly affects cancer outcomes, some data do suggest that patients can develop a sense of helplessness or hopelessness when stress becomes overwhelming. This response is associated with higher rates of death, although the mechanism for this outcome is unclear. It may be that people who feel helpless or hopeless do not seek treatment when they become ill, give up prematurely on or fail to adhere to potentially helpful therapy, engage in risky behaviors such as drug use, or do not maintain a healthy lifestyle, resulting in premature death. How can people who have cancer learn to cope with psychological stress? Emotional and social support can help patients learn to cope with psychological stress. Such support can reduce levels of depression, anxiety, and disease and treatment-related symptoms among patients. Approaches can include the following: training in relaxation, meditation, or stress management, counseling or talk therapy, cancer education sessions, social support in a group setting, medications for depression or anxiety, exercise. More information about how cancer patients can cope with stress can be found in the PDQA registered sign summaries listed in the Related Resources section at the end of this fact sheet. Some expert organizations recommend that all cancer patients be screened for distress early in the course of treatment. A number also recommend rescreening at critical points along the course of care. Healthcare providers can use a variety of screening tools, such as a distress scale or questionnaire, to gauge whether cancer patients need help managing their emotions or with other practical concerns. Patients who show moderate to severe distress are typically referred to appropriate resources, such as a clinical health psychologist, social worker, chaplain, or psychiatrist. Click here to view article at www.cancer.gov. Learning what psychological stress is and what it is not is an important first step in learning to manage it. It is a fact many of the symptoms of mental health diagnosis issues are also the same symptoms that we have when we are under a lot of stress. Although psychological stress can be a big part of our lives, we really do have more control than we think. In order to really manage it, you need to have the right information so that we can take the right actions, and that is sometimes hard to come by, because most solutions for stress deal only with the symptoms and not the core causes of your stress. In all my research over the last 6 years, I have discovered 6 core causes, and most importantly what you can do to eliminate many of the core causes of your stress so that your stress symptoms start disappearing. Click here to find out more. To your psychological stress success. Angela Bussio, turning your stress to success. Founder, Attracting Joy University. http://www.attractingjoy.com. Editor, Real Stress Solutions.